Now remember, all temporomandibular joints are progressive in nature, which is why the sooner you have a patient with these symptoms, you should educate them and you should convince them for treatment. And the best part is treatment is not aggressive, right? Treatment is not invasive. Most treatments are conservative. So when we talk about treatment, it's important to remember that etiology of temporomandibular joint is multifactorial, which means treatment is also multi-dimensional. ऐसा नहीं है कि एक चीज करो ना TMG problem solve हो जाएगा. Now, there are a lot of different things that we have to or we can do in an attempt to improve the symptoms of our patients. So here I'm going to list a few. I don't have the time to go into the depths of these, but one of them that is very important, I will explain that in just a bit. Self-management. There are certain things that a patient can do, should or should not do, the do's and don'ts basically. Then there is pharmacotherapy. You're talking about painkillers, you're talking about anti-inflammatories, you're talking about muscle relaxants, a lot of other medication. Again, time does not permit me to get in the depths of those. But there is physiotherapy that's involved, which is to do with elevators and depressor muscles, and a lot of neck physiotherapy, because a lot of these patients also come in with neck issues. There is psychotherapy. There are some patients who are in chronic pain and those who are depressed because of their pain. There are times when I have to refer my patients for psychotherapy because it just adds the angle of stress management, which we as clinicians are not trained to. All right. Next is low-level laser therapy, that is called as LLLT. I'm a big believer in LLLT. If you have the time and knowledge and understanding about lasers, you will recognize the importance of this aspect. Next aspect, which is splint therapy, is something that I will dwell in. But last but not the least, friends, is oral surgery. Let me tell you, I have been treating temporomandibular joint patients since the year of 2010. All right, 11th year treating them. I have had zero patients who have had to go through open surgery in an attempt to treat a temporomandibular joint. No. A lot of conservative treatment, when combined together, can provide relief to your patients over a sustained period of time. So I'm telling you, I have had massive success treating patients with a combination of these, but most importantly, splint therapy. Now, splint therapy goes by different names. You can call a splint a night guard, a bite guard, an occlusal guard, but the term I love the most is a TMJ orthotic appliance. Why? Because this is how I explain it to my patients. When you have a sprain in the hand, right, it's a muscular problem. What is your orthopedic going to do? The orthopedic is going to give you an orthotic that stabilizes the joint, right? And that is exactly where an occlusal guard comes in. It works as an orthotic. Now, again, what's important to remember, friends, is बहुत सारे designs हैं. There are called deprogrammers, permissive splints, directive splints, pivotal splints. Again, खास मेरे पास वक्त होता है ये सब के बारे में बात करने के लिए, but this is not the platform for that. So I'm going to share with you one design, which is my personal favorite when we talk about management of patients who have any form of disc-related problems. And that, friends, is called as a permissive splint. And here is a picture of the same. A permissive splint has a flat table, all right, along with two small canine extensions. Basically, it is reprogramming the mandible to close in a very specific position, which is skeletally stable. So basically, this splint takes the patient towards centric relation. Now, what should be the occlusion on this splint? As you can see, that small canine extension, place it into the patient's mouth. This is how it sits in. If you make it correctly, it's completely transparent. Patients can barely know that it's there. Even people can't recognize that your patient is wearing a splint. So it can be made extremely aesthetic, thereby improving the patient's compliance. Now, this is how the ideal bite on the splint is supposed to be. I usually give it for the maxillary arch. So mandibular buccal cusp tips. All the buccal tips go in contact with uniform intensity. Now, this is in static occlusion. In right and left laterals, those small canine extensions provide guidance. In protrusion, also the canine extensions are supposed to provide guidance. And we use horseshoe-shaped articulating papers, 100 microns. That's the key here. Normal natural teeth, you use 40 microns, 8 microns. Here, you use 100 microns. and dots in blue and lines in red, very similar to how I teach occlusal equilibration for the natural dentitions. Those who followed my videos in the past, you will know that I use blue for static and red for dynamic. But when you're talking about splints, you have to use 100 microns and horseshoe shape. So this is one such splint that I've designed for a patient. This is an old picture, right? This patient currently is extremely stable. She was only 22 years old when we started treating her. She had disc displacements bilaterally to a point that her tissues had torn and her condyle was in direct contact with the glenoid fossa. Imagine such a young girl with so much breakdown, bone to bone contact. वो knee joint replacement के बाद कैसे knee to knee contact हो जाता है and patient is in severe pain. That is how she came in. We gave her this permissive splint. As you can see, there is uniform intensity contact bilaterally. These are the dot contacts. As you can see, all the buccal cusp tips have one contact each. That is important. All right. That's canine guidance in right lateral, canine guidance in left lateral, canine guidance in protrusion. All right. Now, I know there are no laboratories that design this, which is why I, friends at MIK Dental, have started an exclusive temporomandibular joint laboratory where we design nothing else but TMJ splints. If you are concerned कि भाई मैं splint कहाँ से बनाऊँ, कैसे बनाऊँ, connect with us at MIK Dental Laboratory and we will help you get there. All right. Very, very important. A lot of people ask me this question. अच्छा ये splint कितने time तक पहनना है? And the answer is simple. 24 hours a day the patient is supposed to wear the splint, excepting for when they are eating food. खाना खाते वक्त स्प्लिंट निकालना है, बाकी 24 घंटा पहन के रखना है और कम से कम 6 महीने तक पेशेंट को दिन रात ये स्प्लिंट पहन के रखना है. Now the question arises, पेशेंट पहनेगा क्या? बिल्कुल पहनेगा. Why? Because the splint gives them relief from pain. If you are getting relief from pain by wearing something, there is no reason why you will say I won't wear it. Remember, we are not drugging the patient. You are not giving painkillers to the patient. You are not giving a soft night guard. Please don't give soft night guards. They are a nuisance. You may think you are helping the patient, but you are not. You are creating a bigger problem for the patient. Why? Because the moment you put something soft in the mouth, the patient is going to chew on it even more. More clenching, more bruxing, more pathology. So please do not give soft night guards. This is a hard acrylic splint. Soft nahi hai, hard hai. That is the key important aspect to remember here. All right, now I'm sorry I haven't been able to go into the depths of any of these topics, but there is so much that we can discuss over temporomandibular joints that it becomes a dedicated course. All right, so if you want more knowledge, more information, and if you believe there is scope for you in this, and if there is a calling for you, go ahead and connect with Dr. Hital. I have shared with you a number there, friends. I am personally doing a course, which is a 3-day, full-day course on taming the TMJ. It's about management of orofacial pain from a holistic perspective. Splints hai, pharmacotherapy hai, physiotherapy hai, oral surgery hai, and everything that I do as a team approach in my practice is what we discuss during this 3-day course. I do this only once a year in December of every year. Unfortunately, last year lockdown की वजह से हमने कुछ नहीं किया. But this year I am back. December this year again we have the 5th batch, which means 5 years we have done this batch. Only one batch a year. You know my FMR courses happen very frequently. You'll have 3, 4, 5 batches a year. TMD is only one batch. If you're keen on knowing more, connect with Dr. Hetal. She will give you more details about